Okay, next case. Mom brings in her 4-year-old son with a chief complaint of a red arm. The patient was bitten by the family dog about 3 days ago, and the child's kind of cranky. His right arm is red with some edema to a large area surrounding the dog bite. His temperature is 99.5, heart rate's 120, respirations are 24. So, any level 1 or 2 criteria being met here?
No, I think he's in ESI level 3.
Okay, how come?
He needs labs and IV antibiotics, and he probably has cellulitis.
What about his vital signs? Should you upgrade him based on these?
Probably not. He is within the normal vital sign criteria.
Great. This case demonstrates how important it is to always check extremities and visually assess the area of chief complaint whenever possible. If he had a decreased pulse or compartment syndrome, he may even be in ESI level 2. But good, this patient is ESI level 3.